because of the unique nature of your role, especially working in a hospital setting, 9 a.m. you could be meeting with a Harvard trained physician. 9:30 a.m. you're meeting with a GED educated person that's heading up housekeeping or working in housekeeping. Both meetings equally important, can have a big impact on the flow and how the hospital operates. But I can imagine, just with the diverse audience that you work with, so many different areas of the business that you get exposure to, and especially as you're very much out there and talking and meeting with your staff, that you interact with folks with so many different communication styles, and you get to see so many great things and maybe some not so great things. But Dave, from your perspective, when you hear that somebody is a really strong communicator or they have great communication skills, what does that mean to you? What's the vision that comes into mind?
That's a great question, Scott. And what you mentioned, that diversity of people that I get a chance to interact with, is one of the favorite parts of my job. Because for me, it's always how I can modify my style to make sure that I meet their needs as opposed to the other way around. So that's certainly what I think going in. As far as the best communicators that I have seen, and I had the opportunity to interview 5 hospital CEOs from some of the most successful hospitals around the country, and I found commonality in all of those. And all of that began with a very authentic love for the people that they were interacting with. And you could see it in the way that they communicated. You could hear it in their voice, the types of questions that they asked Scott. I just saw that over and over again. And I had that confirmed by the people that reported to and worked with those leaders. So it's just that idea that in order for me to communicate well, I have to care about you. And that means being present, listening to what you're saying, and being deeply interested in what you have to say. And that's really easy to talk about and harder to do as we go
Mhm.
through our day to day, right?